Namaste. I am Papa Vidyaakar. I am a trained social worker. Started Udavum Karangal 38 years back. Since then, no turning back, caring people who are homeless, abandoned children, and psychiatric patients rehabilitation we have been organizing, community mental health, various programs we have done. At the same time, challenges like tsunami, we built 100 houses for the fishermen who lost their house, and also we also built lot of places like schools who are in need of attention and to uplift the facility which is already there. 10 schools have been given equipments, a nice table and chair. Even teachers, we have provided them table and chairs. So many varieties of things which we have done. It amounts to almost 89 lakhs which we have spent. During last year, when the COVID-19 started, we were really shocked to see the deaths and so many people. There is no difference between rich and the poor. Everyone suffered similarly. There was no beds in the hospital, lack of staff, frontier workers, and also lack of oxygen. All these things were seen. Primarily, I gave attention to our place. With social workers and psychologists, we try to bring awareness about COVID, how to keep away from the COVID, what are the necessary things, what is immunity, and various health education problems. We made them understand. Children were given lot of information. They were given masks. They were told to wear gloves. We were also able to make distances. With all that, we did have 40 patients who suffered. It is a sad thing. And what happened, we started immediately isolating them, and we started caring for them, and all the 40 have recovered. Now it is a non-COVID place. Even in the hospital, Gayatri Hospital, we tried to give health education, and we did not treat them. We guided them to a hospital where they can be taken care. And poor people who just have a small place where all 4 or 5 live, we organize them to a level that how they can avoid this and how they can take care of themselves. India is a country with lot of rural population. In the city there is slums. People have lost job. People have taken lot of debts, and they were hungry. Initially, we thought that we should provide them food packets. So with all that, we started distributing to as many people who are hungry, who are helpless, and we try to give them a sense of awareness so that they can come out. I know a lot of people passed away, lot of people tried to recover, and also it was a nice thing to overcome this challenge. The second part of this challenge is during the second phase of COVID, it had developed more and more infection. Lot of people were struggling without food, without proper facilities, without oxygen, and various other problems. In a family, there are parents who are infected, there are parents who are, grandparents who are in serious conditions, and there are whole family has affected. No one can come out, no one can go there. So it became a problem to the whole community. So we started understanding that, then we equipped ourselves to see them that they are taken care and they can overcome this problem. So first we distributed masks. A friend of mine by name Mr. Bert and his team from Holland, he donated us 4 lakhs at 20,000 masks, which we distributed to the whole community and also to different hospitals and schools and various places we distributed. It was a God-given opportunity that they all able to get the best mask. And I need to tell you something about Narikurubas. Narikurubas is a kind of tribal people. They don't have a house of their own. They are nomadic. They change their places and all that. But now we have come across 250 families in one situation in Chennai where they can be improved, their children can get education, they can earn their own money, and try to give them lot of information which really helps to put life into life. Another project, I think you will feel really sorry about this sharing, but I think I need to tell you that there is a group called paraplegic patients. These are patients, male and female, who have met with accident or have a sudden fall and who have no one to help. I've seen many cases when the breadwinner becomes a paraplegic patient. Paraplegic means from abdomen downwards they cannot move anything. They exist. They have to live in places until they die. They cannot use the washroom. There is no one to care. We have identified 100 patients like that. So we plan to provide them support. Like if they have developed bed sores, we would like to have a nurse to go once in 3 days and make the dressing, and also to keep their house properly and to provide them regular provisions so that someone can help them out in preparing cooking for them. And this would be a great support, because we all human beings. What happens tomorrow? What happens now? We do not know. It is not a calamity, but we have identified 100 such patients. We have been providing vitamins and minerals, and also we plan to have medical support with our doctors from Gayatri Hospital, who will go and examine them and what best they could able to help them. This is not only in Chennai but also sometimes in suburban areas. Our team will be going there with the van and developing a network for them, and it is not they exist, they should live. We all are destined to lead normal, healthy life. It is an opportunity. I think we should all support this. We have just started the pilot study and we need support. And we have been distributing lot of equipments to government hospitals like oxygen cylinders and also various kinds of equipments that could help the patients which they were not having there. So there were no beds, there were no bed sheets, and all that we try to put them on together. And the most prestigious thing is the government hospitals. We provided with nearly 1 crore worth of equipments which could solve their day-to-day problems. In this situation, the vaccine has started. In the vaccine, there was first and second and third phase were there. We try to first protect ourselves, our camp, our children, and our residents who are mentally sick, mentally retarded, spastic, and other children. Most of them were able to withstand that, and totally now our place is non-COVID place, and we avoided the visitors. And another thing is, we are also planning to build a crematorium. It is an electronic crematorium. The government has accepted our project, and anytime we are starting it. One day when I took a body to the crematorium, there were already 28 bodies for waiting, and one crematorium was there. And what they can do, I think, I discussed this with well-wishers, especially kind-hearted people, COVID victims whose one of their relatives passed away and has been in the process of constructing crematorium. And our team, day and night they worked. Day and night they prepared the rehabilitation kits and also provisions and various things. We also gave lot of vitamins and minerals to people who did not know about what it is. But I think they were all saved. It is now a better situation, and we are able to do this with your support. And many people got together. They were looking for opportunities in what way they can overcome their family, isn't it? Not only their family, but also to the less privileged people. I think we were really fortunate enough that we were able to withstand this, serve people. You may have lakhs and crores of money, but the opportunity to serve is very rare. You may throw some few rupees, but I think that makes a lot of difference. I hope we will continue with this rehabilitation work, and we will be as transparent as you can expect, and we will do this as a challenge to the community that Udavum Karangal, helping hands, is there when they need be. Being a social worker is very difficult, and it is a thankless job. It is dangerous. It's a point of no return. I wish the society doesn't need a social worker. I look forward for that, and I feel that there shouldn't be any orphanages, any old age homes and things like that. But while it leads, I am there. Now, I need to tell you how you can join hands with this movement. It is not just a service. Many times we waste food. Children are given in excess, and then they are not safe at home. So many things we need to take a nucleus, a family as one, where whatever opportunity, it need not be money, it could be helping, coming there and participating with our work, going and taking care of at least two patients. One visit, two patients, you can do it. Many times, birthdays, anniversaries, and if you want to wish your own friends, especially when your dear ones, when you want to visit and greet them, this is a special occasion where 100, 200, 300, you can sponsor food, you can sponsor cremation, you can help them with education materials, and you can provide what lot of clothes, even if it is old clothes, it is fine. But I think I felt really sad when I saw children naked. When I saw up to 5 years, they have never had the opportunity of wearing good clothes. Many times, only once we wear it and throw it away. But I think it can be a luxury for these children and also adults who need to be organized. We try to develop this, make a kind of situation that we all join together and uplift them. That is because we live only once.